Hi, welcome to the Elle Russ Show, where I deliver content intended to inspire, educate, and motivate. Engage with me online at elleruss.com and on social media. Enjoy the show. Dr. Anna Cabeca, welcome back, I should say, but welcome to my new show for the first time.
I am glad to be here with you. Congratulations.
Thanks so much. You thank God for what you do, because perimenopause, menopause is such a tough time, and it's so individual. You look it up and you find 500 articles and nothing makes sense. Everybody's still confused, and you have really laid the path for this being as easy and effortless as possible, even though there's going to be some wonky moments. And so let's just talk a little bit about, you've written books on keto, you've got wonderful products. I've used your progesterone cream. I know friends of mine who does as well. You offer products and things to help us, including your maca green. Your maca green, maca green, which is awesome, and your keto green supplements. So everybody can find that on your website. We'll do everything to connect with you, but let's just talk a little bit for the people that don't know your experience as a doctor and how you decided to go forward as the girlfriend doctor, which you're known as, to help people with this.
Well, I was, going to say, just like, our mess becomes our message, right? Our mess becomes our message. And as a practicing gynecologist and I would say one of the best trained in the world from Emory University, there was a time when my doctor's bag was completely empty to help me, empty to help my patients. And I knew there had to be a better way. And so that literally took me on a journey around the world looking for answers. And this is where I've ended up. And over the years, since my own healing journey when I was 39 in 2006 to where I was diagnosed with infertility and early menopause. I had all the symptoms, the no sex drive, the crashing fatigue, burnout symptoms on top of it, but depression. And I was told I would never be able to have another child. I was in early menopause. My labs and ultrasound were there to verify for me and my physicians. And so that was what really took me on a journey around the world. And as I've learned to really recognize the first food as medicine, and healing foods that I've incorporated into my programs, my education programs, and my books, and the healing foods themselves, and supplements and bioidentical hormones to really fill our tanks again so we don't have to suffer. And as a result of that journey, I reversed early menopause and became pregnant at 41, delivering a beautiful, healthy baby girl who's now 14 and is in the rodeos, and
that's so
a lot going
amazing. On. Well, yeah, and you are a true, even though you were a doctor, you were your own patient advocate at the same time, trying to navigate through a world you weren't taught well on or enough on. Okay, so I can say this for people when I chat with clients, at least when I'm doing thyroid coaching or health coaching, and I see that they're approaching 40 or in their 40s, I always bring this up because I would say that I haven't fully gone through full menopause. I guess we could call perimenopause and menopause just menopause if we really think about it. But when I look back in hindsight, wow, I wish I would have started some bioidentical hormone replacement sooner. I really would have. When I look back, I go, I should have had testosterone a little bit sooner. Now, in hindsight, I can see, I should have started, you know what I mean? And I can see that now in hindsight. And there was no need to have those many struggles there, like the struggle of from ovulation until period, feeling like you're gaining 10, 15 pounds, your boobs hurt, you're bloated, and you're a mess.
Right.
That just didn't need, and so I suffered there for a while, not really knowing, because you don't think perimenopause and menopause when you're 42 or something like that. I don't know why it just doesn't come into the mind, but it needs to. Everybody listening, please be aware of things as you go through your 40s, because it could start earlier.
It can. And it's a symptom of hormone toxicity or toxin exposure too. The fact that our liver has to detoxify our hormones, and it is bombarded with endocrine disruptors. And so part of healing that early perimenopausal symptoms is essentially detoxification process. And this is something that, I've experienced over and over as a physician when patients come in with all of those symptoms you talked about. And I would put them on a detoxification program. Let's clean up our diet. Let's, focus on some detoxifying herbs. Let's supplement with those. And I'll see you back and review your labs in 4 to 6 weeks. And when patients would come in for that follow-up, they'd be like, Dr. Hannah, I feel better than I have in years. They already feel better without adding the hormones on. And then I would also look if we needed to add to supplement with the precursors and go from there. So like with progesterone and DHEA and then testosterone and then estrogen as needed on their journey, especially postmenopausal. There's no time limit on, I would like to say, replenishment versus replacement.
I like that.
There's a difference.
Yeah. Gosh. Okay. Another thing, when I was speaking to my doctor about going through this, I will say, I can absolutely attest to the benefits of taking DHEA and pregnenolone. I started to go through the phase where, my periods were off and and I called my doctor and we're talking about stuff. And he said, you know what? In my practice, I found that a nice bridge to full menopause is some DHEA and pregnenolone. And I tell you what, after a month, it completely turned it around. Everything got back to normal. And so I definitely, these things are not snake oil or ridiculous. They are important and an overall general sense of well-being. And I've had low DHEA before in the past with hypothyroidism struggles. So I kind of understood that. That really, really helped me so much. And then the other thing I've learned, and I'm curious as to what you think about this. It's sort of like with thyroid or other things where they see a thing on the lab, they get worried or they think it's fine, but they're not right because that lab number is not right for the person. My doctor was explaining to me one time that with the way that the hormones work, there can be a person who might have high testosterone on a lab result and still need it. There could be someone with low testosterone who still has a high sex drive. So how do you feel about that? Because it feels like this should be more of a N=1 tinkering with an expert along the way versus just strictly going by labs, particularly if someone literally needs testosterone, but it's higher on the thing. And then a doctor says, oh, you don't need any. Do you know what I mean?
I think, yeah, absolutely know what you mean. I always say, and I've lectured on labs and trained physicians in hormone replacement and lab testing. And I will say test and guess. However, treat the patient, not the labs. Yet I always ask, in this case of the person with high testosterone, well, where is that testosterone going? Is it converting to estrogen? If we give more, will they have more estrogen dominance? Well, what type of estrogens will they be forming? Because testosterone converts to estrogen. And so I would ask, well, why is the testosterone high? What's going on there? Is there an impairment in conversion to, or impairment in its detoxification or impaired receptor sites?
That's what I was thinking.
Yes.
In the clean way. Yeah.
Yeah. So you have to, again, detoxify, clean out the receptors, eliminate hormone disruptors, really look at what we're eating, touching, putting on our body, washing our clothes with, what's in our environment. All of these hormone disruptors can really affect your receptor sites. And so for estrogen dominance is a classic example. We are seeing estrogen dominant symptoms in young 30-year-olds and terrible PMS in teenagers. I mean, these are symptoms of hormone disruption.
Yes.
And it's not from our body's own estrogen. It's a bombardment of endocrine or estrogen mimickers in our system. So first step is always to detoxify, to clean up the system, to look at our exposures all around. And that's something I wrote about in my first book, The Hormone Fix. Of course, it takes more than hormones to fix your hormones. And sometimes it's doing less and not more. And coming from the field of lecturing and doing all kinds of, really amazing work in hormone therapies and biohacking when it comes to female and male bodies, when we're looking at a testosterone replacement specifically, we have to remember that it's going to shut down your body's own ability to produce it if you're doing too much. That's number one. Number two, physiology affects our behavior. Hormones affect physiology. Physiology affects our behavior. And testosterone can create novelty-seeking behaviors and anger, irritability. You know where I'm going with this.
Can
Affairs,
you just spell it out, right?
right? Yeah, marital affairs and divorce. And it's something I saw in a lot of testosterone clinics was a high rate of divorce. And that's not the goal when someone comes into your doctor's office, right? That's not the goal.
Yeah.
So we have to understand, well, we're giving something that has, neurologic, psychiatric,
Mm-hmm.
psychologic consequences, relational consequences. So we really want to look at that really carefully and talk about it. So I, became aware of that. And, I always say the eyes don't see what the mind don't know. So once I became aware of it, I started to see it and I
Mm-hmm.
started to lecture about it and counsel my patients. I had this one um, uh, patient I'd been taking care of, and she brought her husband in, who's a VP of a Fortune 5 huge company that makes a large amount of endocrine disruptors, need I say. But yeah, so I was working with him and his hormones and really emphasizing detox, of course, first. And we're doing some testosterone placement because his testosterone levels were shot. And he was VP and very stressful, 58 years old. And so I said, we're going to replace testosterone and I always support the HPA axis when I do that. So whether I gave HCG or Clomid or something else to support him in that way, probably. And I counseled him, these are potential side effects. Let me know if you're just feeling out of sorts. And so he called me up about 2 months later, and I was actually getting on stage to lecture to another group of physicians. And I answered his call before I got on. And he's like, Dr. Anna, I'm thinking thoughts about another woman that I don't want to be thinking. I don't need to be thinking. I mean, something is up. And I said, okay, thank you for calling me. Stop your testosterone. Let's check your blood work. He did his labs that very next day and they were extremely high. And so
Mm-hmm.
teasing back, it just worked out that he was reading the syringe wrong and injecting more than I prescribed. A little goes a long way. And we never want to suppress. And some guys are like, oh, it's okay that my testicles shrink up. I feel great. And in the long run, there's more of a negative biofeedback consequence than just testicles shrinking up. So we need to be aware of that as physicians. We need to understand what it does to men, what it does to women. And yes, it can absolutely be life-saving and game-changing, but we always have to get to the underlying issue and keep encouraging our body to produce as much as it can. And I think that's the art of this area of hormone replenishment therapy.
That reminds me of a story, and I believe it was like a famous Beverly Hills hormone guy back in the day named Dr. Uzi Reese, and he talked about how a woman came in, she had low testosterone, and she was not surviving well in the workplace. She was a high-powered lawyer, so she needed some like mental strength and stamina, which testosterone could provide. He gave her some sublingual stuff, and I guess she did a dropper full instead of a drop. It's kind of the same story. And when she came back in the office, she was like, she was just like raging, just like total raging. And again, talking about the dynamic, at least in straight relations between men and women or different scenarios, that is a problem. That's an absolute problem, right? Or like you said with the guy, going back to like super primal 20-year-old times where you just want to F everything that moves kind of thing. So yeah, you've got to be aware of these psychological consequences. Okay, so aside from testing and finding someone who could be open to this, all right, there's a million different tests for this. Oh, they got a saliva test for hormones. So we have blood and we have the Dutch test, which is a urine test. Which one? All of them? Where do you start? If you feel like you're having some hormonal issues, what is the best way, in your opinion, to test this?
Yeah, and like I've said, I've talked about this, and I think I always tell clients that I will check every one of your body fluids at some time, including stool. Don't worry, your vaginal fluid is going to be tested too. Urine, saliva, blood. I mean, it all is telling us something. And that's what we really need to understand. Of course, there's energy testing too. So we need to look at all of these levels of testing. But when a patient comes in to see me, and this is the way I would do it, I would take blood work I would do a survey, a questionnaire, same questionnaires that I put in my Hormone Fix book. Do the questionnaire first and run lab tests because I'll get those results very, very quickly. And I've got a good idea, what are the biggest needle movers for this client at this time? And I'll follow up once I get through like the foundational stuff, like, okay, we're going to get you on a detoxification support. So now that would be my keto green detox with supplemented with Mighty Maca for liver support and detoxification and adrenal support. And so we're kind of cleaning up the receptor sites, cleaning up the GI tract, supporting the gut microbiome, decreasing inflammation, really supporting hormones at the same time as we're working on waiting on the test results. So I know these are things that, pretty much every person has to do who is symptomatic, and that will give them better results. Yes. And typically 80, 90, 100% better by the time they come back in 4 to 6 weeks. And then I look, okay, now what's our next step? And if I look at it through my head to toe approach, so, through like, what is my assessment? It's going to be a head to toe assessment. So from mental, emotional, psychologic factors, from nourishment, how we eat, digestion, detoxification, hormone balance, sexual function, and structure and function. And those are all things that are part of the 7-step assessment, essentially. So looking at, okay, what do we need to assess? And often I'll run then a urinary panel and look at organic acids and detoxification pathways a little bit more, fatty acid levels, and by clinical exam. And this is often a gifting and it really is a gift that some physicians have over others, some clinicians have over others. But clinical awareness, looking at your patients, their eyes, their conjunctiva, their hair growth pattern, their teeth, their mucous membranes, the skin elasticity, distension in the abdomen, all of these things, all of the body presentation is giving us a sign, a symptom. And so, again, treat the patient, not the labs. And so that's an art. And I was talking to young physicians recently. I was in Paris lecturing for women in tech, and a beautiful dentist and neurologist from the Middle East. I was talking with them and talking about clinical, like how is their clinical training? Because when I was in Egypt way back in 1990s doing medicine at the hospital in Alexandria, the clinicians didn't have books to carry around. Heck, we didn't have iPads, laptops, anything like that. But at least in America, we all had our own books. They didn't. They'd have to go to the library, memorize, and treat clinically. They could look at someone walking in a door and say, this person has this, that, and never need to test. And that was so mind-blowing for me. So I was curious about the clinical training. And a lot of that is becoming a lost art. But it's so true. And as osteopathic physicians, and I was trained osteopath, we were assigned to sit outside in a cafe or a store and watch people walk in and out and be able to diagnose their spinal column. Okay, so what's going on? Like, where do you think they have, is one shoulder lower than the other? Does one leg have to raise up higher than the other? What's the curvature of the back? How are they walking? I mean, all of these things are telling you about the patient. And we get so singularly focused, we sometimes have to, and that's where patients are getting lost in the system.
That is such a good point because, I know you've been doing it a long time. My doctor has been doing it like 30 years. And a lot of times when I'm asking him questions, a lot of the answers are prefaced with well, in my clinical experience, though. You know what I'm saying? Like in my experience, right? And so not to say that a young new doctor isn't someone you should go to, but I do and would prefer someone who's been in the game a long time because of what you're saying. I mean, they really do have the experience to go, I see a problem with this, or I see a problem with that. For example, my doctor has noticed for him personally in his practice that he won't prescribe levothyroxine generically. He always uses Synthroid, but this is not the case with a million of other prescriptions that he prescribes. But he's just noticed in his clinical practice that generic levothyroxine can screw up liver labs or wonky stuff. And he just saw so many inconsistencies over the years. He thought, I'm not doing this anymore. I'm going to prescribe Synthroid because that's what I see in my clinical experience, which counts for so much more than reading a book and then trying to go help somebody.
Well, and I think that's another thing in medicine too. You're taught, okay, draw up a red flag if you hear someone say in my clinical experience, because what does the evidence-based medical research say? And so that evidence-based medical research funded by big pharma
Right.
and with, disclosures of conflicts of interest, you mean
Mhm.
that evidence-based medical research?
That's right,
To be
because
cynical.
I can't prove it as well. The same thing goes for it, you can't prove that it's so. Most doctors would freak out if someone were on T3 only, right? The last resort of thyroid hormone replacement. But there's some evidence, but there's not enough, because the people that own Synthroid is the number one in prescription in the US still to this day. They're doing all the studies at the so if I go to Stanford and I try to do a study to prove that T3 only can work too for people, you think they're going to keep giving Stanford money? They're going to be like, we're out of here. So that is an interesting point. And I do, again, it's like one of these things where I had a friend one time who said, well, I need evidence. And I go, well, you're on T3 only. What's your evidence for that? And she
Mhm.
just kind of didn't have anything to say. And I was like, well, it's interesting that you need evidence here, but not there. But you took it as a last resort. It did help you. That's your evidence, right? At least
Right.
the N equals one. Yeah.
N equals one. I think we really have to look at that. We have to look at that because we know we're so much more than our genetics.
Mm-hmm.
So we're our epigenetics, our microbiome, and this is the piece that matters. And I think we're seeing it now. It's so funny because I've been in the menopause phase for over a decade. And well, for gosh, since 1999. So what's that? 2 decades. But really in the menopause space with my own journey, and as food as medicine since 2014. So this is what we're seeing now. Is we're seeing other women, young physicians that are like, oh my gosh, the shit I've been prescribing isn't working for me. It's certainly, and I guess it really wasn't working for them. They weren't just whining, right? So you're seeing
Right.
more female physicians coming out and saying, hey, we've got to talk about this. Hey, this isn't right. And yet still the medical systems, they're not prepared. I mean, they're not
No.
teaching this, right?
Well, we can't even get as a woman. I cannot get my testosterone from a Walgreens or CVS, but any guy can walk in there and get their testosterone. I have to go to a compounding pharmacy. So that right there, the disparities, with the studies on women, but also that kind of move right there. And I would assume that it might even be covered by their insurance, where mine maybe isn't. I do have a question about some of these hormones. So maybe you can help me out here. And I could be wrong with what I'm saying. I'm just going to throw this out there, which is it seems like when people are going through perimenopause, I know people, so like I haven't gotten any hot flashes or any symptoms of like super low estrogen, et cetera. But if you looked at my Dutch test, 5 women would go, you need to get on estrogen immediately. And I'm like, well, I'm not experiencing anything in that realm. And then I've heard from people, oh, you don't really want to mess with estrogen until it totally tanks. You've gotten the hot flash symptoms or whatever, or beyond menopause. Is there any really right or wrong to it? I mean, is that the one hormone that's like, that's the sketchiest, so we're going to wait? Or is anything I'm saying even true to reality? I'm just
Well,
throwing stuff out I've heard and.
yeah, no, and it's that this piece that's so confusing. Estrogen is one of the safest hormones transdermally. Orally, it becomes dangerous. This is a big differentiator. We
Got
know
it.
oral estrogens, especially if we have risk. I mean, oral estrogens will increase our risk for a blood clot, a stroke, and myocardial infarction. So, oral estrogens will increase our HSCRP, our inflammatory markers. Transdermal estrogens do not. Transdermal, transvaginal estrogens do not. And using estrogen in patients who had a history of breast cancer do not increase the risk of breast cancer, actually decrease morbidity and mortality. So we know estrogen is the safest, but when I'm replacing hormones, I'm starting from the top down, watching where they're going. So and this is why I created products. So I'll just say, I created my balance cream, which has progesterone and pregnenolone, because that's what works best for me. And this is only way I can get it is through, a compounding pharmacy, or from what I've made myself. And I added tripeptide using, peptide science to make it even more rejuvenating. So this is to preface that with, I was a chemist before medical school. I had my own skincare line at one point, and I worked in big pharma before medical school, as well as I was a researcher. So I have a huge background in science and chemistry. And so I love progesterone and pregnenolone together, and it works really well for most of us, and transdermally. So through the skin, it's the safest way. And you know, and you love it too. So I love it. The combination for me works the best. Now, for everyone, it may be different, but this is how I made it available. Then I use DHEA typically. Well, first, I'm going to give you Mighty Maca PLUS supplementation. So 30 superfoods combined to help support your DHEA. And we've seen as much as a 70 to 200% increase in DHEAS in the blood in 2 months by taking 2 to 3 scoops of Mighty Maca PLUS per day. That's helping your body produce your own DHEA. We've also seen an increase in day 21 progesterone with using Mighty Maca PLUS. Again, adaptogens work, and there's nothing else I could write on a prescription pad that worked as well. This was part of my journey around the world, finding these medicinal foods to put together here. So it's a staple. It's part of the foundational ones. Let's get our body to use as much as it can, as best as it can, and then let's supplement. So then I will supplement with DHEA, and sometimes it's just with Julva, which is my topical cosmetic cream for the vulva that has DHEA in it. Sometimes it's a oral DHEA, a BLA tab that's a phospholipid base, a slow dissolution, or a DHEA in oil. Sublingual, those are some additional ways to replace DHEA. But Julva works really well too for that. Plus you get the added benefit of improving the pelvic floor. And then I'll add in, and DHEA converts to testosterone and estrogen. And then I will add on testosterone. And then I will add on estrogen. And in that order. And
yeah,
sometimes I have to do it all at once, but
that sort of seems the way it's usually going with my friends and I and things like that. I will throw out too to the audience. One of the major red flags for me was I was weepy about a lot of stuff often, and it was even nostalgic happy things. I would be crying at a cat commercial, and it got out of control at the point where I started to get dry eyes because I was always crying. And it could be like a nostalgic memory. It could be thinking about how happy my childhood was. It didn't matter what it was. It was it was so obvious, and I was just like, okay, something's wrong here. And then it's funny because now I'm not in that. I'm able to still have emotions. I'm not like a, brick wall here, but it is so much better. And then I see some friends who haven't gone down this road of sort of, exploring what we're talking about. And they're suffering, man. They're fat. They're crying all the time. I know they don't have any energy. And I'm like, you don't have to suffer this way. I've also spoken with women who are past menopause, and I'll, you know how women are. We talk to each other about everything, even if you're a stranger. And I'll ask them, I'll go, how's it going? Did you do any bioidentical hormone replacement? And they'll say no. And then I'll go, do you have a sex drive? And they'll go, no. What the hell? Why? What a horrible life. And then they'll say, oh, and I have to shoot this vitamin E pill up my, vagina every day just to keep it moist. And I'm like, oh my God, this sounds like the worst life ever. I don't know why anyone would not go in this direction. I have also seen women go through menopause using acupuncture and herbs and do it quite gracefully, but I also noticed that they're totally dried up, completely dried up, wrinkled and everything. So I don't know. You don't have to suffer out there. This stuff is safe. Can you tell us about some of the anti-aging benefits of going down this road with bioidentical hormone replacement as we go through this phase of life?
Yeah, definitely. Well, the things that I look at 4 key blood markers. I know we talked about this on an earlier podcast with you and your audience, but there are 4 key biomarkers I really want to look at, because how we're aging on the inside is going to reflect how we're aging on the outside. And the first is your inflammatory marker, HSCRP. That's number 1. That's a measure of inflammation. The second is DHEAS, your marker of your adrenal gland function. How well are you producing DHEAS, sulfate, adrenal hormone? And the third is hemoglobin A1C, what's your blood sugar? And the fourth is your vitamin D25 hydroxy. And we look at these 4 key markers because as we optimize them, we are turning back the clock. And so these are, and using bioidentical hormones help, again, in replenishment, not too much, not too little.
Mhm.
Don't, let's not be afraid of it. I'm a big believer, obviously, because I've wanted to bring it to the consumer and, bypass some of the constraints and restrictions that we have to go through for very, very safe, very, very safe therapies. So, it can really make a difference. And I've seen clients, just pick up their life again and live the best life ever. I mean, I hear it every day. I was just reading some of the testimonials from my website that, a woman, she's 57 years old, and she said, I have to thank Dr. Anna for my life, because I was so depressed. I was so exhausted. I was just trying to make it through one day at a time. And she said, she was doing my Menopause program. So since finding Menopause in the Keto Green Way, she said, and Dr. Anna's supplements, she started that. I felt so much better. And she said, I was able to start a conversation with my physician too, and she's going to begin some bioidentical hormone replacement. So even before you get there, you've got to do the foundational work. But I'm a big believer in bioidentical hormone replacement postmenopausally for life, and perimenopausally, to fix what's broken so we can breeze through menopause and live the best life ever.
Let's talk about your book, Menopause. And then also, I love this new hair conditioner. I mean, that is the one thing people do complain about, changes in the hair. Can you just talk about the hair and skin and the things that happen so that people are out there going, oh, that's happening to me, and they get alerted and can go right to your website?
Oh yeah. Well, and I've lived all this. I was once well over 240 pounds. I had hair loss. I was really struggling. And so it's been part of my mission to, to help others not struggle like I struggled, and I'm a physician, right? I'm a Emory University-trained physician. I should have all the answers. I was a top student. I did not miss anything. So let me just say that, right? So if I was struggling, how is anyone else managing? And so there's a huge part of going back to nature. And with Menopause, there's 5 6-day menu plans that each pause something, because I like to say there's magic in the pause of our lives. So those 5 plans are amazing and are doable, and you can read the thousands of testimonials. They work and they're quick. 6 days. You guys can do that. So that's Menopause. And now the Beauty Locks, because hair, as we get older, and I have long hair, and having had lost a bunch of it at one time, I really have geeked out on the science of hair growth and maintenance. And then I've been doing really well. Then add in, I knew with book launch and with menopause and with my Dyson hairstyling thing, I'm really drying out hair. And so I wanted something that brings the moisture back, but stimulates the scalp for hair growth and is hormone balancing. So that's where I come. And I was using it for myself, and I would get so many compliments. So I'm like, I'll bring this to my audience. So that's where Beauty Locks came from. And I use sea buckthorn oil, which way back to the time of Caesar, Alexander the Great, they discovered it for their horses. And they were in the desert and they're eating the sea buckthorn oil, this sea buckthorn plant, and the horses started having these amazing, shiny, gorgeous coats. And so it was, been known to be a hormone balancer and to improve healthy hair and skin and anti-aging. So it has all of those really good benefits. I added in amino acids to rebuild the hair follicle and shaft. And your hair it feels silky, smooth, and you'll see, definitely you'll see new hair growth. So that's my Beauty Locks formula.
Yeah, and it can be used in a variety of ways. It could be used like a regular conditioner, but also like a 20-minute, like a mask to really get it in there.
Yeah, and I recommend it that way, like whenever you can, to put it in your hair and leave it in, because it is working. And also as a blowout formula, like to protect your hair from the blow dryers and the curling tools. My hairdresser here, I had given him some, and he's he's an expert in long hair. He does all the Dallas Cowboy cheerleaders. And so he started using it as a blowout formula, and he goes, this is the best thing ever. So it's protecting their hair. It's softer, holds longer.
Just for those who are curious, how do they use it as a blowout formula, as a leave-in conditioner, or put it as a conditioner, rinse, and then do the blowout?
You can do it that way. If you rinse, don't rinse it all out, but
Hmm.
you can also just like wet your hands, put some in your hands, and then work it through the ends and the shaft, just real light because it is heavy.
Hmm.
So you can wet it a little bit, goes a long way, rub it in, um, and then go ahead and blow out so you don't get the dryness.
I also do want to say your Mighty Maca, I've said it before, it's tasty.
It
It's
is tasty.
it's delicious. So as far as things go, where you're like, all right, I gotta just chug this down because it tastes like shit, but it's good for you, you know, that kind of thing. That does not
Mhm.
happen with your Mighty. Does not happen with your that product. It's really delicious.
Yeah.
Let's talk about keto. Okay, so because you've talked a lot about this, you've got the keto green supplement, sort of like protein, sort of meal replacement thing. What are you suggesting keto for everyone in perimenopause, menopause who's suffering? Is it keto in and out, sort of, ish? Is it just, hey, try this, get your crap reset, let's do some detox? Or do you really suggest, like, hey, when you're going through the throes of this, stay mostly keto? What's your opinion on that? And I know you'd say everyone's individual, but
You're right. You're right. Again, so and this is where I've really now working with, gosh, hundreds of thousands of people online, right? In my programs, I started, okay, keto green, and it's not just keto, it's keto green. And I'm really big about checking your urine pH. I'm also big about having some feast days. So I've always been in this flex state. Like it's, that metabolic flexibility is really important. And with that said, depending on what we're suffering with, I would say ketones are like is like jet fuel, whereas glucose is like gasoline. So, what are you trying to achieve? If you want that mental clarity and you want to feel really energized, then you're going to want to be keto green longer. But that alkalinizing piece is really important. When I first started this, people weren't talking about adding mineral salts and that's where this comes from. You need those mineral salts. You need the dark green leafies. You need the alkalinizing herbs and spices. You need to support your gut bacteria, or you will not do keto well long term. And so with my menopause, really recognizing like, maybe it's 6 days, 12 days, 18-day, and then take a break. But typically, most people do really, really well, like staying with a plan for 6 days and then either doing a fasting day or a feasting day on that seventh day. So I would, to answer that, everyone that I've worked with that have been in keto and in a long term way feels so much better changing it up. Feels so much better changing it
yes,
up.
yeah.
So
I'm the same way too. I mean, I'm definitely mostly low carb most of the time. And then if I really go super keto, and I think it's true, it's interesting because with keto, when people are focusing maybe a little bit too much on too much of one fat, like, they're doing too much, bulletproof coffee type of stuff, or they're not eating enough greens. It's just a lot of fat and meat. It's, again, you're missing an element there that's important. I mean, I think, and as Mark Sisson would always be like, yes, have a big ass salad. Let's get the veggies in there too. I think people forget that because also they're so satiated initially with keto,
yeah.
that it sometimes can be a thing where you're like, forget to get the proper amount of calories sometimes.
Yeah. Yeah, that's true too. And we need to get a good amount of protein. The other factor is, as women are going through menopause and this change in physiology, I mean, first of all, we have to honor the change. And just like we wouldn't suppress a person going through puberty, we don't want to suppress a woman going through menopause. There's a rewiring, a neuroendocrine shift that happens that's really beautiful. So we're still teasing that out, right? Where does the wisdom, the higher spiritual connection, how does that happen? Let's ideally lift the brain fog of our reproductive years and step into a high level, the highest level of clarity and spiritual growth that we can. I mean, this is and mentorship and philanthropy and joy and happiness for ourselves, just for the sake of being joyful and happy for ourselves, right? So there's this rewiring that has to occur, and I think that's a really important piece. As I see big pharma stepping in and wanting to medicalize menopause. I'm like, okay, like birth control pills through menopause until you're finally done, and then we'll just let you have estrogen only for 2 years, and then you're done, and then go to psychiatrists and divorce attorneys. So that's it at this
That's
point,
exactly where
right?
it leads. Yeah.
Exactly where it is. It's the truth, and I hate that. And that life can be so much better. Life is so much better, and so I think this is what I really want people to be clear about is to listen to your body, get in tune with your intuition, and when there's ever a hard decision, that the getting into ketosis, getting in a keto green way, it's the ideal for that clarity. And I always say, like right now, fast and pray. When you have a tough decision, fast and pray. I'm saying that now because I'm at 44 hours of a dry fast, Elle. So
Ooh, that means no water, everybody. That's rough, right? That's what you
it
mean.
is, it is, it is. I'm just remembering to breathe through it. So I haven't done one in a couple years. So I've done regular water fast and smoothie fast and all that good stuff. But it's been a while since I've done more than a 24-hour dry fast. So
What was your decision to do that?
that
For velvet?
tough decisions in my life right now.
Ah,
Tough
gotcha.
decisions in my life, and so like this is when I really gain that clarity. And also when I, that avoidance behavior, like, oh, I know I have to do this, but I don't want to. Like, is
Hmm.
this really the right thing for me? And so this is that time to do an extended, uh, for me, a dry fast, because it is the one that works the fastest and gives me the most clarity. It is not for the unexperienced, and you have
That's
to
right.
work your way up to it for sure.
That's right. I mean, I will put everything to connect with you in the show notes, but just for everybody out there, it's Dr. Anna Cabeca. That's DrAnnaCabeca.com for all sorts of information, programs, everything you need to get through this time of life. And I mean, I would say, I mean, I think almost, first of all, I just want to commend you as a doctor. You kept searching. I know it was your own issue that you were trying to solve, but when people hear this out there, they should know this is why you got to go to the people who have gone above and beyond what they learned in medical school. And you are one of those. And so thank you for remaining curious like you were back in the day and continually searching, because otherwise there wouldn't be the help available that you offer. So that's just wonderful. There's so many doctors that don't do anything beyond what they learned in medical school, don't care, discount everything, and that's not the way to treat patients. So so grateful for that. What tell us now, I also know too, I on the Primal Blueprint podcast interviewed a high school friend of mine, Chef Contos. I know she's done some cooking shows with you. I mean, you provide so much for people, not just products and ways of being in books and cookbooks, but also like you're doing some live cooking shows and stuff with her. I've seen them. They're great. I mean, you offer so much for your community. How can we join your community? And
Oh,
immediately jump in there.
yeah, definitely. So definitely join me in the Facebook group, Keto Green Community on Facebook. I have a private membership at the Girlfriend Doctor Club. So there's that. And that's a way to get me twice a month in live, like we live have two-way conversations with our groups. And then, of course, on Instagram at the Girlfriend Doctor. So I'm there a lot, lots of content, lots of videos, lots of reels, but a lot is at dranna.com. So
I love it. Well, thank you so much for joining us again. I love my menu pause box. By the way, everyone, that's a great gift to do like that for someone who's going through this rough time too. And you have so many things that you can provide, maybe as a joke gift slash slash helpful.
here's some Julva. Not saying you need it, but
That's
I'm giving
right.
it to you, Elle. You got it.
Here's some beauty locks. Not saying, yeah.
Yeah, my Kiss formula now. So there's that
Yes,
too.
I know. I love that too. I love that when it showed up, I had like this yummy lip balm going on.
Yeah.
What else would you like to leave our audience with about this subject of perimenopause, menopause?
I think that to remember that you're so powerful. Your body is powerful to heal itself, given the right conditions, right? Given the right encouragement, given the right education and knowledge, that you have so much power and you can be the CEO of your health. And I want to empower you, everyone listening, to claim that again and to remember that if you've been given a diagnosis, that is not your destiny. And your prescription is not your description. There is so much to the freedom that menopause brings, and that empowering your body to heal itself has so many far-reaching benefits. So I encourage you in that.
I love that so much. Thank you so much. We'll put everything to connect with you and your groups in the show notes. I appreciate your time.
Thank you.
And for everyone else, we'll see you next week. Hey listeners, over the years, a ton of companies have approached me to collaborate, but I will only promote companies whose products I believe in and that I actually use and consume on a regular basis. So let me tell you about some of my favorite companies that I can offer you discounts for. Rep Provisions, an amazing company doing incredible things for our planet, topsoil, and animals with regenerative agriculture, and it's my #1 source for quality pasture-raised meat and chicken. Visit repprovisions.com and use code L15 for 15% off. I'm also obsessed with a company called Carnivore Crisps. They make a lean, all-natural, and delicious alternative to conventional snacking, made with just real meat and real salt. Totally addictive, and my favorite ones are the beef brisket and the ribeye. Visit carnivorecrisps.com and use code PALEO10 for 10% off. I also love and regularly use Paleo Valley products. They make amazing supplements and delicious paleo products. I use the superfood greens powder, grass-fed beef sticks, the organ complex, and their bone broth bars. I love the lemon and apple. I also use their essential C complex and more. Visit paleovalley.com/promos/Elle Russ for 15% off. I also love Primal Kitchen. They make delicious paleo-approved, gluten-free, grain-free, soy-free, and no refined sugar products, and I use them daily, from their collagen powders and sauces and marinades to their avocado and olive oil. So good, so healthy. Visit primalkitchen.com and use code L10 for 10% off. I also love paleo powder and use it almost on everything I cook. They make incredible seasoning blends, and they also have these incredible grain-free coatings that feel just like crispy breadings that you would have had prior to knowing that there's another way. So visit paleopowder.com and use code L15 for 15% off.